Southwest Georgia is facing a serious shortage of family medicine physicians. Studies show that we will not have enough physicians to serve our friends and families' needs in the next few years. In collaboration with community leaders and organizations, Phoebe Foundation is planning to build an on-campus housing complex. These units will be designed for temporary student use and will be furnished and available for short-term lease. Because they are on the Phoebe campus, they will be safe, convenient, and an impressive advantage for our programs.
Bringing students to Southwest Georgia is a real challenge. And the reason is we're isolated. Most of the academic institutions are located 3.5 hours from Southwest Georgia. So therefore students tend to stay in their own academic worlds to get their clinical training. And so what we do is give them an opportunity to come to a different area, have a wonderful clinical experience, and experience part of Georgia that they're not doing on a daily basis. And our main goal is to reduce the barriers so that they would come to Southwest Georgia.
I actually had never heard of Albany, Georgia. I was not going to come here. I was not going to apply here. A friend of mine was here and talked to me over a vacation while I was getting ready to set up my applications for residency. And so she said, I'm really gonna tell you, I think you'll like it here, apply. And so on a whim, last minute, sure, I'll throw an application out there, thinking, I mean, if they offer me an interview, I'll come down, say hi to my friend, and head on back to where I'm staying at the time. I was impressed by the quality of care, the quality of training, to a point where I thought, wow, I actually could see myself living here, not just during the residency, but beyond that.
We compete with 4 other locales, Athens, Rome, Savannah, and Augusta, to get the best of the best down here to go through these residency programs. And by providing safe, affordable, and let me mention this, convenient student housing for these folks is going to help us to attract the best, which in turn means that the community will benefit by their staying around the area and servicing the needs of our citizens.
Temporary housing is difficult to find in Albany. These students are coming from out of town and have to quickly commit to the program, find a place to live, and organize their furnishings, clothes, and schedule. By offering this housing, our program will have a unique advantage and will continue to attract the best students possible.
The need for housing is significant. If we're going to get people and place them in a campus where they're able to take care of our patients, learn from our patients, and allow us to help recruit these people to come back here, the idea of providing a place for them to live while they're here only makes sense.
Very frequently I get calls from students that what are we doing for the housing, and I tell them that currently we don't have particular area where I can direct them to, but they have to find their own housing. But I think once we have established this housing complex here, it'll benefit them tremendously.
So the concept is to create this complex, if you will, of housing that is immediately adjacent to the education center. And each one of the units inside this complex is intended to be a freestanding housing situation with bedroom, living room, kitchen, and everything that they would need to enjoy autonomous living but be in community.
One thing that's really important to me about this project and providing housing for medical students is that as a mom, I've watched my daughters go through the college experience and find housing, and one of the most important things to me was to know that they were safe and that they were in a secure environment. And I think about these medical students coming who were about the ages of my daughter, and I think, wow, I want them to be in a safe place.
So how do we know that these students will stay in Southwest Georgia and provide the primary care services that we need for our families and friends?
It's been proven over and over again that when you are training, when you are teaching and training physicians, that over 70% of them stay in the area where they trained. Needless to say, we need that pipeline. We need that pipeline that will give us the fruition we need to provide us with the physicians that we'll need in the future.
At Phoebe, usually the ratio is that if you have a 60-60 ratio, means that if you have a 60% of the physicians who stay within the 60 miles radius, then it actually would make a lot of sense, because they already have established that connection between the patient's community and the referring physicians. We have been fortunate that our ratio is slightly higher, and it's up to 70%.
Well, a primary care provider is typically referred to as a medical home. And a primary care provider is generally somebody that is boarded in family medicine or internal medicine. And the importance of the medical home is that that's where somebody goes for preventive care, for acute care, and for chronic care. And the reason that's so important is because that individual gets to know the patient, they get to know their family, they get to know social issues and barriers that they have. And then when their care gets complex, they're able to coordinate and integrate the care as they send them off to different specialists.
What we found was the ratio of primary care physicians to the general population was below the state, the region, and the national average here in Southwest Georgia. That ratio, research has shown us, is a real predictor of the quality of life for the citizens of that region. So having robust primary care supply was very important.
And what working in the primary care clinic has taught me is how incredibly important, some of the more quiet jobs in medicine really are. These are the physicians that the patients see every month, every year. These are the physicians that know their birthdays, know their church, know their Bible study groups, know their neighbors, know everything. In a sense, they're a much more integral part of the community than a big academic center. And that's medicine for real. You can't fake that. You have to know your patients. We're medical students. We are busy 24/7, 365 days of the year. Driving down to Albany, spend one whole weekend looking for housing and not knowing what we're going to get. It's like, for us, a really big gamble. And it takes a lot of time. We lose time studying, we lose time with our family, we lose time doing things that we should be doing in order to find housing that we perceive to be safe. If we already have something that's already simplified and is reasonable, then we're probably more likely to incline to go into it.
Why is our push to attract more physicians and high-level healthcare providers to our region so important to our community's future?
People are looking for, especially as our population ages, is an adequate supply of physicians. And one of the reasons that our board of directors was visionary over 25 years ago was to see that it needed to invest in medical education, and that by growing our own and taking responsibility for investing in the future physician manpower of this region, that we could impact the quality of life for the citizens of this region and discharge the mission of this institution to be here for all in need. So this project is a byproduct of that vision, that initiative, that goal of having a very key resource, in this case a human resource. Our organization wants to be at the forefront of making sure that as people consider relocation or continuing to stay in this region, that one of the reasons they do so is that there is a robust physician manpower supply.
Everyone knows that physicians are retiring on a daily basis throughout Georgia and throughout the country. There's over 200,000 shortage just in Georgia alone. On the flip side of that, besides healthcare, beside the physicians, the economic impact, it's been proven that every physician is over $1 million industry in his or herself. That is very, very important. At the same time, your manufacturers, your local businesses, all of those folks will grow and locate where there is good health care.
One of the great things about being a business leader is you have to see things in advance. You have to see how trends are changing. If you want to have a successful business in a community, it's very important that you have great health care. Industry comes, that's one of the major factors why industry comes to an area.
They said most doctors don't want to practice in the rural, but there are some that do. They want a slower pace of life. They enjoy the wide open space. They want to raise their families in a nice, quiet community. They do. So those are the kinds of folks that we're looking for.
This effort is a visionary step to ensure that we have urgently needed primary care physicians in Southwest Georgia. We are partnering with several agencies to ensure that we anticipate the needs of our residents and students. We need your help to fill the gap and help provide funding for this important project. Please join us and support this effort. Your gift will be an investment in the future for us all.